We can all agree mental health care is health care.
Today, the Surgeon General issuing a rare public health advisory.
Devastating mental health effects.
About 1 in 5 American adolescents report having anxiety and depression.
I look at kids on their phone, and my first instinct isn't why are they on their phone? It's like, yeah, why would you want to look up at the world right now?
America's youth mental health crisis.
Youth mental health crisis.
The youth mental health crisis. It's a topic we've heard echoed over and over again. Young people are over-pathologizing. Social media is to blame. No one knows what to do. There's a lot of concern, but not a lot of advice. The reality is that Gen Z's mental health journey looks radically different from generations that came before. They're living in a tumultuous world with technological resources that didn't previously exist. A lot of reports on the topic don't take these factors into account. Or they do, but then they state the obvious, that the internet is both good and bad, without explaining the why and how and what role these digital tools should play moving forward.
Will you commit to ending Finsta?
Our team set out to capture a more accurate picture of Gen Z's mental health journey. What we found flips a lot of current narratives and offers a dualistic, hopeful take for a generation in need of guidance. This is Remapping Recovery, a research report about Gen Z's quest for better mental health care. Let's get into it. The modern journey. All right, let's start by drawing this thing out. Our survey mapped out 5 key points on the mental health journey. We have onset, when your symptoms first start showing up, research, looking into those symptoms, think Google, books, or talking to a doctor, diagnosis, this can be self-diagnosis, professional diagnosis, or unfortunately, misdiagnosis, treatment, which includes therapy, medication, hospitalization, support groups, and a long list of alternative methods, and management. You did all of the above with success and you live well with your condition. In an ideal world, getting from point A to point B on this map is pretty linear and easy. There are no major detours or barriers. But that's not the reality for most people. Instead, this journey is often long with many twists and turns, and these complicated factors are the very things we set out to understand. Especially since a lot of existing research on this topic is outdated and doesn't take modern factors into account. For example, according to the National Library of Medicine, it takes the average person with OCD about 13 and up to 17 years to get diagnosed. However, according to our nationally representative study, the time from onset to diagnosis was 28 months, with over 1/4 reporting they were diagnosed 1 month after symptom onset. This suggests that the mental health journey is now far quicker than it used to be, and likely far different in other ways too. How so? Let's explore. The Gen Z experience. First, it's important to consider the landscape that shaped Gen Z and how they've approached mental health compared to previous generations. Our report found that nearly half of them experienced some mental health issue. And if we add in those who know of someone struggling with a mental health condition, that number becomes 84%. When asked about the social or political issues they care about the most, the majority of them had mental health as their number one. Our report makes it clear. More than any other generation, Gen Zs are likely to recognize mental health issues, both in themselves and others, and seek professional help. This shouldn't come as a surprise. In the last decade, pop culture and social media have exploded with mental health references, characters, and information. Seriously, it's everywhere. Known as digital natives, Gen Z is the generation that is constantly tuned in, which unsurprisingly can get pretty overwhelming. When they scroll their feeds, they might see a live stream of police brutality, warnings about climate change, and heated political debates,
You could do abortions.
all within 30 seconds of waking up.
Now, every terrible thing is in their pockets. And they have so much more information, and we're not wired to be exposed to that much information and that much negativity.
The result is increased feelings of nihilism, existential angst, and a hesitancy to pursue traditional healthcare. Because why rely on larger systems when they can't even stop the world from burning? And ironically, being desensitized to mental health issues can swing into the opposite direction and spiral into over-pathologizing behaviors. Gen Z is also struggling with finding a path forward when they do attempt to pursue traditional healthcare paths. Some of the biggest barriers our respondents mention when trying to start their treatment journey include long waitlists for therapy, financial strain, and issues with insurance. So what do young people do when so many paths are blocked off? Try their best to self-therapize. The rise of self-diagnosers. Many people who hear Gen Z and self-diagnosis in the same sentence will roll their eyes. They think today's young people are using 7-second videos from unvetted influencers to diagnose themselves with serious mental health conditions. And there is validity in wanting Gen Z to be more mindful about the content they consume. Lots of people do go down the wrong path because of something they see online. But our data showed that Gen Z is aware of this. They're actively trying their best to find and promote credible sources, which makes their self-diagnosis all the more valid. 60% of Gen Z and parents of Gen Z respondents are pursuing self-diagnosis, with fewer than half seeking out just a clinical one. Despite common assumptions, we found that Gen Zs who were self-diagnosing weren't just choosing a label and moving on with their lives. In fact, Gen Zs take nearly twice as long to research mental health conditions as their parents. And in more than 90% of cases, Gen Zs are coupling their self-diagnosis with a professional one, or plan to. Granted, self-diagnosers also report being less likely to be covered by health insurance, more likely to spend money on treatment, and more likely to be in healthcare debt. Why? In many cases, they know they need specialized care because of all the research they've done, but they simply don't have access to it. So they try alternatives or they pay out of pocket. But here's where it gets interesting. The majority of Gen Zs who self-diagnosed reported being half as likely to be misdiagnosed compared to Gen Zs whose parents took them through more traditional healthcare channels. While other factors might play a role, this implies that Gen Z taking matters into their own hands is ultimately more beneficial in the long run. Wow. This DIY approach also shines a light on systemic issues. It begs the question, why is a teenager better off using credible online resources to self-diagnose and find care than turning to a parent or primary care provider? Now, hearing this question might cause a knee-jerk response, especially from older generations. Are teenagers more well-equipped? Wouldn't it be better to see a therapist first? This is where we break down the parent gap. Parents of Gen Zs, largely Gen Xers, grew up right at the start of the digital age, without much social media or media literacy.
Can you explain what internet is?
Think AOL startup. So naturally, they rely on it less when starting their mental health journey. Where do they turn to instead? The doctor's office. 62% of parents with a Gen Z experiencing a mental health condition say their mental health education is with healthcare professionals versus 47% of Gen Zs. And only 27% of parents are turning to social media to learn about mental health compared to 45% of Gen Zs.
The older generations of parents and how they approach mental illness is a thing that needs to be legitimized by an outside source, by a professional who holds certain credentials that they trust and interface with, and then really buying into that trust and ultimately a lot of mistreatment and misdiagnosis being related to buying into one professional or a few professionals' opinions when frankly it's so evident and obvious that most professionals are not adequately trained to diagnose and treat everything.
They're also more likely to see mental health as a short-term problem rather than a lifelong commitment.
The older generations tend to come in 5-7 sessions and that's it. The younger generations, it's almost as if you can't get them out. They want to keep therapy as just a natural part of their life. So they're much more willing and accepting to process their thoughts and feelings. The older generations is more solution focused. Let's go fix this issue and then let's move on.
What this generational divide leads to is a lot of Gen Zers being dragged along a clinical path haphazardly. Parents don't always do their independent research, and our findings prove that this comes with consequences. Gen Zers were 2 times more likely to struggle with misdiagnosis as a result of going their parents' route, and their parents were 2 times more likely to say that the biggest consequence of a misdiagnosis was giving their child the wrong medication or subjecting them to the wrong therapy. Supporting this, my parents ranked last on Gen Z's list of who they turn to for mental health education and advice. Not great. The majority of Gen Z and their parents said that this beginning research phase was the most difficult part of their mental health journey. With both generations struggling, how much harder could this journey get? Well, harder. The BIPOC struggle. Almost everyone knows what it's like to struggle with stigma at some point in their life. It's isolating. You might feel like the only person dealing with a scary experience. You might be too afraid to bring this thing up to anyone, even a best friend or a trusted doctor. Well, if you're a person of color, these concerns are only amplified. Compared to their non-BIPOC counterparts, BIPOC were 2 times less likely to ask for advice on their mental health journey from their parents, 3 times more likely to choose self-diagnosis because their family wasn't supportive of them being clinically diagnosed, and were statistically less likely to pursue treatment at all. In fact, on every confidence metric we measured, Gen Z BIPOC respondents were significantly less confident on their mental health journey than non-BIPOC respondents. 83% said that they don't have much confidence in the healthcare system. This mistrust is likely due to a long history of maltreatment, as well as a lack of BIPOC clinicians and therapists. So in the face of stigma, less social support, and untrustworthy healthcare systems, what helps this marginalized group? Media. Notably, they were 2 times more likely to rely on online influencers for mental health education, and 25% more likely to receive their mental health education from TV shows, movies, or pop culture.
Put mental health first because it shows how strong of a competitor and person that you really are.
This last point underscores how democratizing pop culture can be in getting out messages about mental health to people of color, who represent nearly half of Gen Zs on the mental health journey. For communities like BIPOC, well-vetted, incredible pop culture resources can be the difference between isolation and recovery. Emphasis on the well-vetted, incredible part.
I see social media and the internet as a tool to amplify information. And so the information that's helpful is greatly amplified. The information that's not helpful and inaccurate is also greatly amplified. And I think the people who are consuming this and who desperately need help are exactly that. They're desperate, they're vulnerable, they're suffering. And so they're really vulnerable to information that might be correct and helpful and also incorrect and unhelpful.
This highlights a key concern echoed throughout our report and by society at large: mental health and media literacy. Vulnerable people need to know where to turn to for information and who's qualified to speak on a subject, which brings us to the dropout rate. While there are clear upsides to having greater access to mental health information, this access doesn't always mean easier, faster journeys. In fact, for some, it's having the opposite effect. Conservatively speaking, our report found that 1 in 3 Gen Zers and parents of Gen Zers who are looking into mental health end up just dropping out. These are people who haven't even made it into treatment. They often give up at the onset and research phase. When asked why, 30% of people said that their biggest barrier was conflicting information from both online and healthcare providers, and a quarter said that they're simply overwhelmed by the sheer amount of information that's out there. Alternatively, some people are less afraid about the volume of information and more afraid about what they might find out about themselves.
When you're looking to figure out what is wrong with you and you're looking online, there is no way to avoid stigmatizing, biased, discriminatory, unmotivated, hopeless information.
Researching certain symptoms and conditions can come with a lot of anxiety. What does this say about who I am? If the information I read doesn't match my experiences or sound hopeful, am I a lost cause?
We've got this barrier to people, even though the access is there, they won't do it. Let's say they go, okay, I'm just gonna do it. But then that's when things get ugly. It's the shame. I can't believe I even had these thoughts to begin with. How am I gonna tell my loved ones? How am I gonna have kids? What am I gonna do when I relapse? I am gonna relapse. All of that. I mean, that's where we're in danger of losing people.
Some people are also disinterested in going through the full treatment journey. For 1 in 4 people, once they receive a diagnosis, they stop searching for a clinician or treatment. Stepping back and looking at Gen Z, their parents, self-diagnosers, and BIPOC, we found that only half of those who start their mental health journey finish successfully with treatment. Yikes. So what is the solution to keep people from dropping out? Our best bet is to catch them in the research phase, which means making sure that everyone has access to good psychoeducation. When asked what would keep them from dropping out, 2 solutions took the top spot. Number 1, having more well-informed healthcare professionals, and number 2, having a singular credible source for all mental health concerns. Once people are well-informed, they can find the right diagnosis, and from there, finally start specialized treatment. And this is where the mental health journey should actually begin. All this other stuff before, the hamster wheel of misdiagnosis, misinformation, inaccessible treatment, and stigma, shouldn't be taking up weeks, months, or in many cases, years of people's time. Our report forces the question, how can we make this journey easier and faster for people in need? It's time to remap. Too many Gen Zers are embarking on their mental health journey with no map in mind, trying to navigate complicated language and an overburdened healthcare system in an already overwhelming world. They are painfully aware of all the problems they're experiencing, but they don't understand how to approach them most effectively. Digital resources, or compasses as we like to call them, have stepped in where professional resources have left off. Already, Gen Zs are the first to leverage these resources to pioneer DIY diagnoses. While healthcare professionals point to the pitfalls in this approach, they also admit that it's getting more people in the door and increasing outreach to providers. Ultimately, if social media is what generates conversations, destigmatizes mental health, and inspires young people to seek assistance, then it's a lifeline for people who couldn't find help otherwise. While online resources have been effective to varying degrees, it's not enough to leave vulnerable populations on their own in the wilderness. Gen Z's nihilism and the systemic barriers that fuel it must be combated in order to get more young people the help that they need. Gen Z carries some of this responsibility. To keep morale alive, they need to do more than simply complain about systemic issues without taking any action. They might hate to hear it, but combating nihilism will require less screen time and more investment in community building, socialization, and connecting with the people and environments around them. And beyond Gen Z, well, there's a responsibility for the healthcare industry, parents, social media platforms, school systems, workplaces, social services, and government officials to step in, step up, and provide a new North Star in the journey towards effective and efficient mental health care for all. If anything, our report shows that these changes are possible when we embrace innovation, adapt to the shifting journey, and invest in resources that guide people towards recovery. Thanks for listening. Our report, Remapping Recovery, How Gen Z's Quest for Better Care is Pioneering New Paths Forward in Mental Health, is available for download at madeofmillions.com. And amazing news, it's free! This research was conducted by our team at the Made of Millions Foundation alongside our partners at Culture Co-op. Huge thanks to our expert contributors, Dr. Jody Adewale, Chrissy Hodges, Dr. Courtney Tracy, and Uma Chatterjee. If you like what you heard, make sure to keep up with us here on YouTube and on our other social channels. And if you have thoughts on this research and what it all means, let us know in the comments because we want to hear it all. See you next time!